classification of the diseases, we have neoplastic disease. So this results in new abnormal tissue growth. So normally, cells do proliferate and differentiate para malaman kung anong klaseng function ba dapat yung meron ng isang cell. So when we see proliferation, it refers to cell division. Our cell continuously divide para mas dumami siya. Kasi di ba may mga namamatay na cell like dead cells, para magkaroon siya ng panibago, cells to proliferate. While differentiation, it refers to the process of cellular specialization. So this is for the function of the cell itself. So meron tayong tinatawag na differentiated cells and undifferentiated cells. For differentiated, these cells have differences that are small or hindi masyadong nakikita yung pagkakaiba. While undifferentiated cells, or what we also call as poorly differentiated, the changes are significant. Like, kita natin kung may pagkakaiba mismo dun sa structure ng cell and even to their function. So, for cancer, or for tumors, we have benign and malignant. So, when we say benign tumors, these are well-differentiated cells with uncontrolled growth. So, mabilis siyang dumami, pero differentiated cells siya. Like, the differences are small between those cells, but they have an uncontrolled growth. Padami sila ng padami. Kaya siya tinawag na benign. These are just localized into a certain part. And these are non-invasive. Unlike malignant, when we say malignant, the cells lost the control of their proliferation and differentiation. It also changes its functional capabilities. So kapag sinabi nating malignant, these are those na pwedeng tumuloy as a cancer. So these cells could metastasize. Pag sinabi na metastasize, pwede siyang mag-spread into other parts of the body. So meron tayong mga ways of metastasis. Pwede siyang maging hematogenous spread, which spreads via blood vessels, and lymphatic spread, which is via lymphatic system. So, ganun yung mga ways para kumalat si cancer cells. So, kapag nag-metastasize siya, pwedeng in proximity lang or mas malapit lang doon sa primary site ng tumor or mas malayo doon sa primary site. So, ang tawag doon sa in proximity area or the tumor or the cancer cells metastasize in proximity, malapit lang. Invasion po ang tawag doon. Example, the patient is detected a breast cancer. Okay? So, yung cancer cells niya nasa breast lang. An invasion could be lung cancer. Pumalat si cancer cells from the breast going to the lungs. Bakit sa lungs? Kasi siya yung malapit sa breast. Ang tawag doon, invasion. While, kapag naman ang cancer cells is nagmetastasize sa malayo, okay, malayo sa kanya, nangapit bahay siya ng ilang kanto. Tawag doon, seeding. Okay? The cancer cells metastasize with a distant site. Tawag doon, seeding. Seeding as in nagtatanim, like seed. So, for example, the patient is detected with breast cancer again. So, instead na mag-invade siya dun sa mga kapitbahay niya, katabing bahay niya, gusto niyang lumayo. Pumunta siya sa brain. Okay? So, yung pag-metastasize niyang yun, from the breast, going to the brain, ang tawag doon is seeding. Okay, so those are the forms of metastasize or metastases of the cancer cells. So always remember that when we say cancer and carcinoma, these are not synonymous with each other. Magkaiba sila. Kasi when we say carcinoma, this is the type of the cancers that is from the epithelial tissue. Okay? Katulad lang din yan nila sarcoma. Well, sarcoma, is from a connective tissue, leukemia is from blood cells, and lymphoma is from the lymphatic cells. So when we say carcinoma, sarcoma, leukemia, lymphoma, these are the type of cancers, specifically the origin of those cancer cells. So as a radiographer or as a radiologic technologist, why do we need to learn these neoplastic diseases? Kasi we are the one who perform imaging procedures that are used as a primary diagnostic and staging methods. Ano yung mga imaging procedures na yun? It could be CT scan, MRI, PET scan, or yung positron emission tomography, radiography, and ultrasonography. So usually ang unang pinagkakakitaan sa mga examinations na to is radiography. Kasi siya yung pinakaunang test na ginagawa together with the laboratory test. Okay? So kapag gusto lang nilang ma-undergo pa ng study yung mismong tumor na nakita, pwede silang magpa-CT scan, MRI, PET scan, and ultrasound. Pero yung pinaka-primary na imaging procedure kung saan unang pwedeng ma-detect is radiography. So aside from diagnostic, hindi lang naman tayo pang diagnostic lang or hindi lang naman tayo na-enclose as imaging procedures. We could also perform treatment using radiation therapy. So for cancer treatment, pwedeng through radiation therapy, through a surgery, through a hormone or anti-hormone therapy, or through an immunotherapy. So when treating a cancer, among those procedures, minsan pinagko-combine nila. Like for example, they could operate on a tumor, like pwede sila mag-surgery na tanggalin yung tumor from the site, and then they can perform radiation therapy with chemotherapy. Well, actually, it is up to the oncologist. Depende sa oncologist, depende sa stage, depende sa type ng cancer ng patient, kung anong klaseng treatment yung gagawin. So, for the goal of the treatment ng cancer, dalawa lang yung pagpipilian natin. It could be curative or palliative. When we say curative, the cancer cells are removed, or the patient with cancer is cancer-free. It could last for 5 years or more. Pwedeng totally cancer-free na siya kasi minsan may nagre-reoccur na cancer. Pero pag sinabi natin curative, we can say that the patient was healed. Unlike palliative. Palliative, so the patient undergoes treatment just to lessen the pain. Okay? Para lang mabawasan yung sakit na nararamdaman ng pasyente galing sa cancer niya. Yun yung palliative. We perform treatment to lessen the pain and suffering of the patient. Para lang din medyo ma-prolong mo yung life ng patient. But not necessarily that we can treat those cancer as they will be going like cancer-free. Hindi sila yung talagang totally healed kapag palliative. We're just there to treat the cancer cells para mas malesen yung pain ng patient. Okay? So that is the neoplasia. So since sinabi ko kanina that we are here to diagnose and we perform imaging procedures for the staging methods, let us now learn the staging system of the cancer. So we have here the TNM system. It is one of the most widely used cancer staging systems, and this has been accepted by the Union for International Cancer Control of the American Joint Committee in Cancer. So pag sinabi ng TNM, it indicates like T is for tumor, N is for nodes or lymph nodes, and M is for metastases. So T, size and or extent of the primary tumor, N, the amount of spread to nearby lymph nodes. M. The presence of metastases or secondary tumors formed by the spread of cancer cells to other parts of the body. So here in TNM system, a number is added to each letter to indicate the size and or extent of the primary tumor and the degree of cancer spread. So paano natin malalaman para saan yung mga number na nasa gilid nitong TNM na to? So here is the staging. When the number beside the T, N, and M is 0, okay, it means that the carcinoma in situ is in early form. While if the number beside the T and M is 1, it means it is localized. If stage 2 or if 2, it means that it is early locally advanced. As for stage 3, it is late locally advanced, and stage 4 is metastasized, kung saan kumalat na yung cancer cells. So here is the application of the TNM classification system. We have here the classification and the description of the tumor. So for stage 0, it says that the T, N, and M is 0. Like, there's no evidence clinically. Occult lesion. For stage 1, there is a small lesion, as you can see on the classification. Beside T, meron tayong number 1. And for nodes, 0. And for metastases, 0. So again, the description is small lesion confined to organ of origin with no evidence of vascular and lymphatic spread or metastases. Ibig sabihin, upon imaging the part, okay, may nakita silang small lesion, maliit lang, na nasa organ or origin. Pero, wala siyang vascular or lymphatic spread. Or hindi pa siya kumakalat sa mga katabing parte ng katawan. So for the stage 2, we can see that the tumor has 2 beside it, and for the nodes has 1, while metastases has 0. So it means that the tumor is less than 5 centimeter and it is invading the surrounding tissue and the first station lymph nodes. But again, there's no evidence of metastases. Yung tumor, maliit siya sa 5 centimeters. But there is a spreading or the surrounding tissue and the first station lymph nodes. Medyo kumalat na siya sa katabing tissue. And meron nang nakaabot sa first station lymph nodes. But again, hindi pa natin masasabi nag-metastasize na siya. Kumbaga lumalaki yung small lesion na nakita natin for stage 1. So for the stage 3, we can see that the tumor has 3, the nodes has 2, and the metastasis has 0. It means that the tumor is greater than 5 centimeter, with fixation to deeper structure and with bone and lymph invasion but no evidence of metastases. So yung small lesion na nakita, lumaki na siya ng greater than 5 centimeters and mas bumaon siya doon sa structure. Kumbaga mas naging embedded, mas na-fixed, mas lumalim doon sa structure na pinaglagyan ng mismong tumor. And mas nag-invade siya papunta sa bone and sa lymph nodes. But again, there's still no evidence of metastases. While on stage 4, there will be a more extensive lesion than above. Ibig sabihin, mas lumaki pa siya sa kung anong size meron sa stage 3. So for example, sa stage 3, nakita nila that the tumor is like 8 centimeter in diameter. So for stage 4, it could be greater than 8 centimeter. and makikita na nila na nagmetastasize na yung cancer cells. So that is the application of the TNM classification system. So if you have questions regarding the neoplastic diseases, just leave me a message. Alright, so thank you for listening and goodbye.